My name is Lisa Baker, and I'm the VHA National Program Director for the Resuscitation, Education, and Innovation Program, as well as the Director for Resuscitation Education and Outreach within SimLearn, the VA's National Simulation, Learning, Evaluation, Assessment, and Research Network based in Orlando, Florida. The VHA Resuscitation Symposium is an opportunity to bring stakeholders from nursing, physician leaders, our resuscitation education champions, as well as those from quality together to talk about how best to operationalize best practices to improve the quality of care provided to veterans and improve outcomes. My favorite part of the Resuscitation Symposium is the aha moment, when our participants realize that resuscitation is everybody's responsibility. And without having the appropriate stakeholders at the table, we really can't move the needle to impact outcomes at the facility level. We know that in 2025, there will be updated guidelines and evidence that will help to drive our journey even further as it relates to resuscitation, education, and outcomes. We're excited to be able to facilitate another VHA Resuscitation Symposium following the release of those guidelines, so we can all come together to identify how best to operationalize it in order to impact the quality of care we provide to those that are entrusted to our care. So I was drawn to resuscitation education many, many years ago as a young nurse, primarily because I wanted to be part of the education community, and that was back then the easiest way to step into the role of teaching others how to care for patients in an acute state. I think that later on in life, it became a little bit more personal to me as my dad died from sudden cardiac arrest. So I have a vested interest in ensuring that we provide the right tools and resources to those caring for our veterans and our family members, our loved ones, to ensure that they have the best possible access to care. For this symposium, our target audience are the Ready Facility Program Directors. So they are those resuscitation education champions at the deck plate, working day in, day out to operationalize this overarching program. I see some of that overlapped with, we try to bring in quality leaders as well as nursing and physician leaders throughout the visit to represent those clinical areas and have the ability to go back to their facilities to, I guess, be a force multiplier and a spokesperson and a champion for the overarching resuscitation program.